From the studios of Foxborough Cable Access, located in the center of Foxborough, Massachusetts, you are watching Around Foxborough.
Hello and welcome back to another special edition of Around Foxborough, coming to you live from FCA TV in downtown Foxborough. I'm your host, Jared Craig, and I am here. Want to let you know that we have up-to-date information on our website, and that is fcatv.org/COVID-19. You'll be able to find all the information as far as how many reported cases we have in Foxborough, which currently stands at 5 is the information I have, as well as what restaurants are open and closed, municipalities, and things like that. So lots of information there. Please feel free to check that out. I am honored to be joined today by our state representatives. We have State Representative Jay Barrows here. Thank you so much for being here, Jay. And coming live from Zoom, we have our state senator, Senator Paul Feeney. Again, Paul, thanks for making time for us today as well. So just starting off for both of you, we just want to hear how you're doing in this crisis. Personally, professionally, how is everything going? Are you managing okay?
Start with Paul first. You get to go.
Thanks so much, Representative. Jared, thank you for doing this, and to the folks at Foxborough Cable Access for keeping people up to date. Look, these are crazy times. I see it. I'm feeling it. I know there's a lot of trepidation out there. There's a lot of concern. We're really just trying to do our best, as you are, to keep people informed, to let them know kind of up-to-date information, what's happening out there. You got to be truthful and transparent with people in times of crisis. And we've been trying to do that and just make sure that we're keeping people informed. So I appreciate you doing this. I tell you, this is just something new, being on a local cable access show live on Zoom, but it's certainly not something that is unique these days. I know folks are working from home. They're on Zoom all day long. I've seen many video feeds of kids running in the background and all sorts of stuff happening on these video conferences. So it seems like this is our new norm. But we'll get through this. I know there's a lot of pain, a lot of questions out there, but I appreciate the opportunity to be on here and to give information with the representative. I just want to mention to Representative Barrows and I, we have the pleasure of representing 3 towns together in my district, which is comprised of 9 cities and towns. And a lot of the issues that we're hearing about from constituents, from businesses, and from local officials, Barrows and I work famously together to try and resolve these issues, and at least to get the information up to the administration and to get information back. So I appreciate the opportunity to do this and to be on with Jay and to talk directly to the people of our community, because these are big issues, and I know there's a lot of questions.
Thanks so much, Paul. You seem like you're in good spirits. We appreciate that. And Jay, would you like to tell us how you're doing?
Just to reiterate, I think Paul and I have been swimming in numbers and WW dots, and just to try to grab a hold of good information to share with our constituents. I want to assure everybody that we're working on really new and innovative ways to deliver services to those that might never have been eligible, might have had to wait to get something, whether that's unemployment, SNAP benefits, kids getting a breakfast or a lunch at school. Yeah. It's really amazing how this community has come together in such rapid fashion, and I'm so proud to work with Paul. We share all the similar concerns. Again, I don't want to see anybody be hungry. I don't want to see anybody go without. And I know we have resources that we're leaning on, both locally, county, state, and federal. And I think everybody is working in unison, and it's brought people together. So we're hoping to be able to, on a daily basis at least, reach out through Facebook. It seems to be the easiest for us to deal with, to provide accurate information from the various mass.gov websites. And anybody that doesn't have the ability to get online, call Town Hall, call me, call Paul. We can share you with some numbers and email addresses, and reach out to us, and we or our staff will get back to them as soon as we can. That's
great. Yeah, I'm sure we'll have links to those resources on our site as well. Thank you so much. You said that you've really felt the community come together. Have you seen that statewide, district-wide? I know I haven't left Foxborough in the last couple of weeks. I'm assuming you're both traveling at least to the State House. What's going on outside of our town?
Well, I think the same thing that you're seeing. I mean, like today, it's been just beautiful out, and I think people are getting a little stir crazy and going for a walk, and just enjoying the beautiful weather and trying to sort through their kids what to do. We got some guidance this morning on what we're going to be doing now that schools are closed until May 4th.
Right.
On how the learning is supposed to take place. And I know today in Mansfield there were Chromebooks delivered to the 3rd through 12th grade, so that they can have some real online learning.
Great.
And try to work with everybody to make sure that we're reaching out to the entire community. But I think you're seeing the same. I get the news the same way you do, and people need to really take serious the social distancing. I think if we do that, we got a shot at stopping this sooner than if we don't.
Yeah.
I know that's what I'm seeing a lot of. I see people stopping in the street. My office is on Main Street in Mansfield, and everybody stops about 6 to 8 feet apart and has a conversation.
Yeah.
But I don't see a lot of hugging going on.
Yeah. Or over Zoom. I've been talking to my friends friends and family on Zoom, Facebook.
Right.
Yeah.
Right. So I think that's it needs to be the new normal, and it needs to be taken seriously. And I know we, all of us, I think, repeat it again and again and again. But no one is immune from this. And the statistic that I just saw, today, we were, I think, initially led to believe that perhaps youth weren't really carriers, if you will, and
Yeah.
the numbers are proving otherwise, that younger people can get this the same as the old.
Okay. And you're talking about even kids. You're seeing
Yeah, I
kids
mean,
getting it.
there's a few,
Yeah.
so who knows, right?
Right.
So, and now they're all home, and college kids are home, and spring break's over, and all this stuff. So we really have to exercise it, not only with the public, but even with people inside our family.
Sure. And sorry, Paul, did you want to?
Jared, yeah, if I could just add to that, I know, the representative and I have been involved in this thing, obviously, since minute one when we started hearing rumors that, it was going to be bad here in the Commonwealth of Massachusetts and that we were going to have to deal with this. And then just kind of working through, different phases, right, and different steps, and, hearing, okay, we got to start canceling large gatherings of people. And then it was, well, maybe we have to start canceling, schools for a little bit or after school. And then it just kind of devolved into what we are in now, which is a major pandemic. And part of that is to make sure that we have kind of up-to-date, accurate information. When we first started hearing about the coronavirus, the COVID-19 virus hitting the shores of the United States, it was, well, if you're vulnerable or if you're an older citizen, it was a particular concern, and that still exists. But, I just want to mention, I had a really, really close friend of mine, somebody who I've known for over 20 years, and I spoke with him yesterday. He has a 26-year-old daughter, perfectly healthy, high school athlete, no problems. She's, fit 26-year-old young woman who wasn't feeling well, got a fever, had a little trouble breathing, went in, they tested her, they said she had pneumonia. And within 2 days, they had her on a ventilator. She's been on a ventilator for about a week now. She's stable and showing some signs of fighting the disease. Wow. But, it goes against what we were hearing early on in this whole process that, not that there was an immunity for young people, but I think there was a lack of attention paid to, folks that weren't either, folks with pre-existing conditions or they weren't older. 26-year-old young, perfectly healthy woman who's on a ventilator right now because of this virus. And like I said, she's showing signs of fighting it, but she's still sedated and on a ventilator. She can't breathe for herself. So I just want to reiterate that message, how important it is that people realize that nobody is immune, that this is a serious issue, and there shouldn't be panic because it can be managed as long as we're all doing the right thing. But I just want people to realize how important it really is for all of us to be staying home, to be doing what we need to do to socially, do the social distancing, and think about not only the older folks that are really susceptible to this, but young people too that find themselves in a hospital and on a ventilator.
So that's one of the questions that I actually have for both of you, because correct me if I'm wrong, but from what I can tell, Governor Baker hasn't mandated a lockdown or shelter in place. It seems like he's been sort of purposeful in just advising one or not necessarily. Do you think that the legislature is behind that decision? Do you think that they're looking for a little more action, less action? How do you feel like what we're doing right now, is it working? Do we need more? Do we need less?
Yeah, I'll say that, obviously, like I mentioned a minute ago, this was kind of done in phases, and it was, I think the governor and the administration have done a great job in understanding that the data and the science has to drive these decisions. Yes, we're all in political jobs, but when it comes down to a crisis, you cannot be political. This has to be about leadership, and I think the administration has realized that you need to let the data drive these decisions. It's not about picking a date and saying we're going to go back to church, or we're going to go back to work. It's about talking to the experts, talking to the public health officials, and making those decisions. And I think in Massachusetts, the administration has done a good job in that. There was some significant momentum behind some of our colleagues in the legislature who wanted to, shut everything down early on and have a shelter-in-place order. But I think, taking kind of a measured approach to say, look, we need to be social distancing. We cannot be putting people in schools, putting students in schools, having a couple hundred people show up at St. Mary's on a Sunday, making sure that people weren't going and sitting 2 feet away from each other in a restaurant. That was the right approach. And I think as this escalates, you really have to let the science dictate what those decisions are. And that's the point we're in now, which is why just before we came on air, Jared, I got an email from somebody who said, when is this going to end? I mean, when can we go back to work? Do we think that the order for non-essential people to stay home, is that going to be extended? Like the school cancellation was extended, and we really don't have an answer, right? I mean, we're looking at a day-by-day reporting of the virus and how much it's spreading throughout our communities. I will say that I err on the side of shut it down and keep everybody home, and I know there's some trepidation with that when people have to be able to continue to go to work or else our economy collapses. But I always err on the side of, look, keep people safe. The economy can be recovered. We'll figure out ways to do that, but you can't recover lives. So I think the governor's done a good job. The administration's done a good job, and certainly the legislature, we're working closely with them every single day to make sure that we're making the right decisions for all of our communities.
Thanks, Paul. Jay, I wanted to get your feedback on this
just
too.
To echo, again, I applaud the governor and the work that he and the administration's doing. These folks are working 20 hours a day and cranking it out. I had a conference call or a Zoom call this morning with the Chamber of Commerce, and we had about 15 businesses on, from big ones to little ones. And people are starting to feel the effects of, the 147,000 unemployment claims were identified today.
That's the Massachusetts number.
That's the Mass number today. And I don't know how long it takes to count 147,000, but that's a lot of people. I don't go as far as saying we should just shut it down. I think businesses like mine, we're practicing social distancing. We've locked our doors to the public. We're dealing through mail slots with people. People need notaries, or they need to pay their premium, and they need to make a change, and they do present themselves. We're doing that both here in Foxborough and in Mansfield.
Sure.
So we're working through the door. We've got our folks in cubicles. Everybody's equipped with hand sanitizer, Lysol, disinfectant stuff. So you can practice it in some businesses. I know the banks are open and kind of following those same guidelines. So I think those businesses that are on the essential list, they need to practice the social distancing within their organization. Yep. Keep their employees safe, and let's try to keep getting something done. We've got a lot of people now that are working online, but we're running into challenges because of their kids, their children, home from school. Mommy, Daddy, I need the computer. I've got to get this done.
Yeah.
Mommy and Daddy are doing a proposal for, it's...
I'm one of them, yeah.
Yeah, it's crazy. So we're trying to work through all of those different things. So we'll get there. We will get there. And again, this is about flattening the curve. This is about taking the arc out. I just wanted to share real quick to the point we made earlier on the numbers of young people that are involved in the various age groups, and I apologize that I'm reading this off my phone. But under 19 confirmed cases, we have 53
in Massachusetts.
In Massachusetts, between the ages of 20 and 29, we have 425 confirmed. 30 to 39, 433. Now the number starts going down. 40 to 49, 386. 50 to 59, 437. So that's the highest group, but just by a few. 60 to 69, 329, and 70 plus, 352. So, that young group between 20 and 40, there is over 850 cases. So it is real. They've been the kids that may be away at school, getting back, maybe working in New York City, coming home, who knows? I mean, there's a lot of people that were traveling a couple of weeks ago.
Right.
So Rhode Island, and I don't know if, Paul, if you saw this, the Rhode Island governor has posted National Guard folks at the airport and at the train station. If you're getting off from New York, you're automatically, or you're requested to quarantine for 14 days. They're taking down all your information. They're following you, making sure that you stay away from folks. So that's pretty serious.
Is there talk about doing that at Logan?
Not yet.
Okay.
So,
not that you're aware of, at least, yeah.
Not that I'm aware of. And again, I think the travel piece, from what I understand from folks that are in and out of there a lot, it's really, nobody's flying.
Okay. Yeah, I would assume.
They absolutely have to.
Right. So we said at the top of the hour, the top of the show, that we have 5 cases in Foxborough, and that last week Foxborough, actually, the town declared a state of emergency. Can you explain for our town what that means in terms of funding at the state level, or long-term versus short-term funding? What does that open us up to, and is that something that we need to really worry about right now?
Do you want to do that when you want me to do it? Because I really don't know.
Go ahead.
Other than the declaration to get out to the public that this is serious, there's a number of municipal relief bills that have been drafted and have been filed to help with their budgets, to help with town meeting, to help with local elections, and so on and so forth. It's a pretty big omnibus approach to try to fix things.
And I assume there's bipartisan support for all of these?
Everybody's trying to, get along and let's get it done. So we're trying to. The legislative process seems like Mondays and Thursdays, Fridays, we're getting stuff between the 3, right? You've got the House, the Senate, and then the governor's office.
Yeah.
So people are really working well together. The declaration, I think it just opens up, county support, state support with DPH, Department of Public Health.
Sure.
And just makes things a little bit smoother, and also gives some authority to the local Board of Health.
Great.
I don't know what you want to add, if there's more to it.
No, that's exactly right. I mean, you're going to see, at every level of government, essentially, we've seen emergencies declared from, a state of emergency here in the Commonwealth of Massachusetts. Many communities, like here in Foxborough and others in the region, are declaring states of emergency in their own towns. And it does, it frees up, obviously, some funding as that process unfolds. But at the same time, it also gives powers to whoever the authority is having jurisdiction, whether it's a town manager or a mayor. And those are the sorts of things that we need to do in a crisis like this, because they need to be able to make decisions on the fly. And sometimes there's so much bureaucratic red tape in normal, in the way government normally operates. You just can't have that in a time of an emergency. For instance, I was on a conversation, I think it was about a week ago, with a couple town managers in the area in my district. And we were talking about the guidance that we were getting on gyms, on people going to gyms. Obviously the government had declared an order. At that time, it was no more than 25 people could gather. And the businesses were really doing a lot of good work in trying to limit how many people were going in and out. But then we started to notice that places like nail salons, barber shops, hairdressers, tattoo shops, they were remaining open, and by all accounts, complying with the 25 people or under at their establishment. But when you're talking about a virus that spreads through contact, probably not a good idea to be going and getting a massage, right? So I think a couple of the town managers started looking at it, saying, well, what can we do locally if there's not going to be any guidance yet or decisions from the Commonwealth? Can we make the decision then to shut these businesses down? And because they have declared states of emergency in their communities, they were able to do that. And that's one of those examples where I think a lot of the actions that were taken municipally led to a statewide action by Governor Baker and the administration this week. So, it frees them up and allows them to make kind of decisions on the fly for the safety of the public. And, unfortunately, that's sometimes you got to declare an emergency to be able to do that. But I think the communities have used it wisely.
So thank you so much, both of you, for that answer. I know so many industries are getting hit hard. The gig economy is really, excuse me, taking a beating. But restaurants, hotels. I know even the Orpheum Theater today, which I'm on the board of, but I saw that they have posted a fundraiser, a GoFundMe online, because fledgling newly born company, they're not able to have people come in. Is there talk in the legislature about helping those kinds of people? I know the bill that's going to go to the House, I think tomorrow, on the federal level is talking about unemployment. Is there going to be anyone, is the state taking care of?
We've filed, call it locally, in the State House, a bill that would support those folks that are 1099 employees. So if you think back a little ways, back to the last kind of rough patch in 2008, 9, 10, 11, a lot of people couldn't get their jobs back. So a lot of folks that were a little bit older went and said, well, I'll be a consultant, right? And I'll work for 3 or 4 different companies, and they can just pay me, and I'll pay my taxes, but they do it on a 1099 basis. So there's no withhold. The individual doing the work is responsible for all their taxes, but they weren't required to pay into unemployment. So we filed some legislation, I think it went in yesterday, that asked that we expand unemployment benefits to those folks. The feds in their bill, from what I read this morning, also include that same provision. So it'll be easier, obviously, if it comes from the feds. It's still our money, but it comes from the feds to support that program, so they'll follow suit. But as the governor explained today, they've got to create a whole new, like, how do you capture those people?
Right.
Like, if you work for somebody and you get a W-2, we know who you work for. And when we look at your taxes, and from 2018, if you haven't filed 19 yet, we know who you work for, how much you made, and your income was the remunerator on what was paid for unemployment and other taxes. So when you're 1099, we don't have that.
Yeah,
so we've got to go back to 2018, 17 to see what these people were reporting for income, so that it's close. It's not going to be perfect, but so that's a whole another deal. And then
conversations happening is
happening,
what you're saying.
And then you've got 147,000 claims that came in that they're counting. We had 50 people in that department 2 weeks ago. Today we have 300, and probably by Tuesday we'll have another 100 added. So we'll have 400 people. A month ago, our unemployment rate in this area was 2.9%.
Unbelievable.
And again, it's kind of like, somebody catch me, I'm falling.
Yeah.
We're just waterfalling in terms of the unemployment rate. So the 1099 folks will be all set. The feds included a boost in unemployment benefits. We had passed, I think it was Monday, Paul, that the 7-day waiting period was waived to help our friends in the restaurant business, if you will.
Great.
That were kind of immediately closed when restaurants were closed.
Yeah.
And people even couldn't get geared up for takeout and all those other things that they're trying to do. So that was done. Again, the waiting period will be eliminated. Still trying to deal with tip income, for those folks, because that's really a tough one. The Orpheum and many others, there are grant capabilities, from what I understand today, that in the federal bill, there'll be opportunities for grants, which means basically here's some money to keep you going, right? Because we know that the contributions are going to drop, because again, if people aren't working, you got to feed your family first.
Absolutely.
And we need to preserve the arts, and I think both Paul and I certainly have been supportive in the past, and we'll keep it going. But
thank you for that support. I acknowledge that.
And it's trying to, again, there's so many things going on, and then we've got the state budget we've got to work on.
Right.
As do the municipalities.
It really is everything. It's not.
It's everything. Yeah.
Everything's being affected by this right now, right?
And Jared, if I could just add to that, and you asked a question on unemployment, and Representative did a great job in explaining kind of what these discussions have been. I will tell you that on the Senate side, similar to what they've done in the House, we've stood up kind of a working group with the idea that we were going to, kind of all of us have a central repository of, where we could feed information to and then seek solutions. And one of probably the most robust discussion that we've had, other than the public health stuff, which is our number one focus, is on unemployment. And what do we do now that the economy is literally collapsing around us? What do we do to make sure that people are able to pay their rent, pay their mortgage, pay their bills? In the discussions around unemployment insurance, not to get too into the weeds, but I think people would appreciate this. For us, this is not uncharted territories. We've seen economic downturns before, but there really is no understanding of how long this is going to go and what the total and complete impact is going to be to the economy. So one of the things that we've been struggling with is, how do you take care of the gig economy workers? How do you take care of the 1099 employees, as Jay was talking about? How do you take care of sole proprietors and people that are self-employed? One of the difficulties is that they haven't paid into the unemployment insurance pool. So we want to make sure that that unemployment insurance pool remains solvent. It's going to be strained as it is with traditional claimants. What do you do to take care of this new group of workers, which is, quite frankly, an expanding group of workers, which is probably enough for another show? But how do you handle that and make sure that the unemployment insurance pool remains solvent? The federal bill that was passed last night in the Senate, that hopefully goes through the United States Congress soon, offers a lot of relief to those folks, and there's different ways that it happens, and their tax credits and kind of a down payment on their future tax liability. But that'll help. On the state side, as Jay mentioned, there is legislation already moving, and there's discussions with both House and Senate leadership and the administration to what our approach is going to be in Massachusetts. We're not unique from the rest of the country, but at the same time, we have a robust rainy day fund. We've budgeted rather conservatively over the last few years. Revenue has been up the last couple of years, which we've been able to invest in that rainy day fund. And just kind of looking at other ways to leverage the state balance sheet so that we can take care of these workers and make sure that we don't have an even worse situation that we have. So those discussions are ongoing, but I just want you to realize and have people realize how nuanced this really gets when you're talking about people that don't pay into the unemployment pool, but at the same time, we need to make sure that we're taking care of them with this crisis.
Yeah, that seems like a difficult situation to be in and balance, because there's so much behind all of this, and I don't want to see anyone left in the cold. So I can imagine you probably don't either, because these are your constituents.
Right.
One thing that's a little muddy for me, I was wondering if you folks could clarify a little bit, is the difference between the federal government's role in this bill that we keep bringing up, and the state government, and then the Foxborough municipality. Like, where are the lines drawn? Who is it? Massachusetts' responsibility to help the unemployed in Massachusetts, and then is it the federal government's employee job to help everyone else? How does that work? Who's taking care of who? I guess is the question.
The funding is going to come down from the feds that help going to shore up what we're doing. Ultimately, I think it's the state's responsibility. However, with this funding coming down from the federal government, if we do certain things to meet the standards that their legislation is written to, and we incorporate those into our system, then we can count on some relief on that. But I don't know, Paul, if you agree on that, but I think it seems as though we've got our own system, we've got to run it, and the feds are going to kind of, I think, juice it with cash, to be honest with you, if we do certain things that they're asking. So,
yeah, that's exactly right, and that's why we were, I don't want to say waiting. I mean, obviously, this is an urgent situation, and we already started kind of drafting legislation on unemployment a couple of weeks ago when this really started to get moving. But it was really important for us to see what that federal package was going to be, because that's where we get the bulk of the funding for that. There's people that pay into the unemployment insurance pool, but at the same time, the federal bill that we're seeing is really going to drive us, and kind of allow us to do what we need to do to make sure that people get paid. But there's other pieces of that federal bill too that are part of that. I mean, the stimulus checks, which are going to be the direct payments to folks, and some of the small business loans and things like that. All of that is important. We can't simply operate in a silo. All levels of government have to work together to make sure that we're addressing, the unique needs of each community and each state throughout the country.
Great, thanks for that. I think this is sort of coming to me in waves. It was first, I want to protect my family. I don't want anyone to get sick. Let's all buckle down. Right. And now there's the second wave. It's the economy is is, collapsing before, not collapsing, that's extreme, but, the Dow took a big hit. Unemployment is higher than it's been, I think, in decades. So, I think people just want to feel like they're going to be okay. I think people want to hear from the two of you that it's all going to work out.
Well, I try to be as optimistic as I can.
Yeah.
And I hope that this doesn't last long, right? So, again, we ask people, please just do the 6 feet thing, and let's try to, if you've got it, quarantine, do a good job doing that. Give your family the 14 days that they need to protect your loved ones. Yeah. And if we do that, I see our economy in Massachusetts as one that's very diverse and robust. We live in a phenomenal area when you think about just the diversity in Foxborough. And the amount of people that are in service businesses, restaurants, retail, sports, entertainment. It's amazingly diverse. We're not a coal mine, right? We've got a lot of different things going on. We got high tech, down the street at Schneider. I mean, GE. We got a ton of stuff around here. So if we can resolve the health issue, then we can get back to work. And when we think about 147,000 claims, well, if those claims are 4 to 5 weeks and not 4 to 5 months or 52 weeks, we can get back at it.
Yeah.
And I know that people want to do that. But again, we've got to take care, and Paul said, the health piece is number one. Once that's eradicated or really reduced to a minimum, and people aren't scared to death to go outside or, pick up a gallon of milk at the store, we got some challenges. So people have to practice good hygiene. It sounds silly, it's stupid, but that's really what we've got to do to stop it.
Yeah.
And live up to, if you get it, you owe 14 days in the corner. With,
right.
So and make sure that we have the hospitals are prepared for the surge. And I'm hearing some stories now, that people are getting filled up. If you walk in with 100 people into Sturdy or 100 into Norwood, you're putting some stress on the system.
Yeah.
So, but I think we're going to return back to, that robust economy. I really, that's my hope, and that we can turn this thing around and get going and look back at 2020 and say what a start that was.
That's the hope.
So, and get back into it, So that's the point.
Jared, I think you said it right, that, people just want to know that they're going to be okay. And there's so much concern. And, quite frankly, now as we see the numbers steadily kind of escalate, and we know more and more people that are sick or in the hospital or test positive. The representative and I have a colleague at the State House that came out publicly yesterday and said that he had tested positive. And we're starting to see it amongst workplaces and neighborhoods and every community across the state, that somebody knows somebody.
Right.
And if it's not them, they know somebody in their family or somebody close to them. And that's going to happen. That's going to continue to escalate. So, I heard an economist a week ago that said the best thing that you can do for the economy right now is to stop the spread of the virus. Right. I mean, this has to be the focus. This has to be number one. And to make sure that people know, as you said, that they're going to be okay, that the nurses have the correct, level of PPE and personal protective equipment, that the firefighters that may be responding to a home, or the police officers that are doing yeoman's work in the last couple of weeks dealing with this crisis, that our first responders know that they're going to have the PPE necessary to keep themselves safe and to keep others in the community safe. And that they know that if they do feel sick, that there's tests available. Right. And I think in Massachusetts, we're starting to see a steady increase in the testing capabilities. There's multiple labs that are on board now, which is cutting down the wait time for folks. We're able to, because there's more testing available, lower the threshold, kind of that circuit breaker that would trip so that you could be eligible for a test. But people want to know the tests are available. And I think the federal rollout of that was woefully inadequate for a long time. Now we're starting to see more of it through the state, which is important. And then that people know that they have the correct equipment. We're hearing all this talk about ventilators, but the talk, that we've been dealing with PPE and testing kits. Now the conversation is going to move to ventilators and to that equipment that's important to keep people alive that are, dangerously ill from this virus. So people want to know that these things are being taken care of. As state legislators, Representative Barrows and I, we do everything we can to advocate. We try and pass good public policy to make sure that these things are in place. But it's a struggle, and we feel it and we hear it. We hear from residents every day that they're worried about their job and they're worried about the economy, but they're also worried about their parents that are older, and they're worried about them getting sick, or they're worried about a loved one that's in a nursing home that they literally cannot go and visit right now because of this virus. So it's important that we do absolutely everything possible to stop the spread of this virus, and the rest of it we'll figure out. But to just make sure that people are not going out and coming in contact with each other, shaking hands, high fives, hugs, and all that stuff. I know it's difficult. I get it. I feel it myself. But it's vitally important over these next couple of weeks, because if we don't flatten that curve, then the economy is going to be the last thing that we're going to have to worry about. There's going to be a lot of pain in our community. So right. I don't think it's a time for people to panic, because we do have the capability to do this. We have the ability to change the course of this virus, but we just need to stick together and do the right thing. And I think, Representative Barrows and I see examples of that every single day in our communities, where people are stepping up and they're doing the right thing. They're making sure that PPE is donated to the first responders and to the hospitals. They're making sure that they're, canceling, classes or groups that are getting together, or birthday parties, so that they can stop the spread of the virus. And if we just keep on doing that, then I think we'll get through this okay. But these next couple of weeks are just very important for every community across the country. So
that's my next big question for you too, is the schools are closed until at least May 4th. It seems like that's the next time we're going to have this conversation about school closing. Has the legislature talked about what this means and how we're going to deal with this? Are you working with the Department of Ed at all, or has it not gotten that far? No, there's a lot. There's actually, I got a chance to post today the guidance that came down from Department of Ed for students, and we got discussions about the MCAS. What are we going to do? We've got discussions about grading. We've got discussions about graduation. We've got a lot of discussions. Is my daughter going to be in second grade again next year? I'm sure if it's your daughter, she'll be fine. She's probably already acting like she's in fifth grade. She's great. So there's ongoing discussions. But I think today, with yesterday's announcement, and they've been working on this, but come out with some more very formal plans for the districts to follow. As I said earlier, we're seeing a lot of Chromebooks go out to students. We're seeing that engagement now, and hopefully, May 7th, we bring it back. What's interesting, again, kind of pre-COVID-19, Foxborough enjoyed their highest week ever the week that they closed on Friday, attendance-wise. Attendance-wise, yeah. Interesting. It was just truly amazing. So that's true, huh? It was that was one of the anecdotes that I got about that. But we're going to be working with the Department of Education to try to come up with things. But I suggest to folks, and I sent around to my staff today that have young ones, and said, here's some guidance. Here's what you can do as the parent. Be the parent. It's tough, but try to squeeze in a couple hours a day. It's important to read to the kids every day. Read out loud. Let them read. Give them some crazy little projects to do. How long does it take to make an ice cube, or how long does it take to melt? Yeah. I mean, just different things to kind of engage them. So hopefully we're doing that. I mean, childcare is now for emergency folks only. So, everybody is trying to figure out, and then you haven't got your grandma, grandpa to watch the kids, because, I mean, it's getting people really gemmed up to try to figure out what to do. It really is everything. It's trickled down to, it feels like every aspect of life. Yeah. Exactly. Senator Feeney, do you have anything that you want to add about this with the school closings piece? Yeah, it's so much unknown from the parent. Jay and I were together a couple weeks ago before this, got really bad, and we had a conversation with Dr. Barrows, superintendent in Foxborough, and what were the plans? What were we starting to see? Was there much guidance coming down? And at the time, you didn't even think that there could be a possibility that schools were going to be closed for a week, never mind for more than a month. And it happened so quickly. And one of the difficulties and the challenges that the school department here in Foxborough and across the Commonwealth really faced was
making sure that we're going to continue some sort of learning, remote learning for the students outside of the classroom. It happened so quickly that it was difficult to develop those plans. So I just want to, a shout out to all the educators out there. I mean, Jay and I have been talking with a lot of teachers and school administrators who are doing incredible work to try and connect with their kids, some remotely. I know there was some guidance yesterday from the Commissioner of Education who talked about WGBH now being a partner so that they could host some educational programming. School systems that have gone above and beyond to get the Chromebooks out so they can be some sort of, whether they use Blackboard or whatever the software is on their Chromebooks so that they can learn remotely. And, finally, for the school lunch issues, I mean, one of the major challenges that we faced when the decision was made initially to close schools was the understanding that there are a lot of food insecure students. The only hot meal that they get, or really the only nutrition that they get most days, is at school, whether it's through breakfast, the breakfast program or the lunch program. So school systems and volunteers and communities came together around this idea that even though we weren't in school, we were going to make sure that students were getting their breakfast, that they were getting their lunches, and that they were being nourished appropriately. The public schools have changed over the years, and a lot of students in our district and across the Commonwealth rely on school for a lot more than just their core curriculum education. And that's a testament to the educators and to the superintendents and to the school committees that do so much work. So that's a difficulty when you shut down the schools. I know it's going to cause a lot of challenges to folks. Students are home and it's tough to find care. As Jay mentioned, the daycares and preschools were shut down in addition to K through 12. I'm sitting here now at home, which is a licensed family childcare. My wife has been in the business for a long time and does amazing work with some of the youngest students around in the area, and she's struggling. She's been putting out videos to the students to make sure that they she's reading to them and things like that. But there is some growing pains here, and it's difficult for a lot of families. I know the early educators, a lot of them have opened their centers and other places for emergency childcare for folks like first responders, firefighters, police officers, teachers, grocery workers, right? Folks that really need to keep working to keep this economy going in a crisis. What are they going to do for childcare? So it's caused a lot of challenges throughout the educational systems here in Massachusetts. I think a lot of people have stepped up and have met those challenges and are offering great solutions. There are no easy answers. Jay mentioned MCAS. MCAS is a graduation requirement per statute in Massachusetts. Well, certainly there hasn't been the prep time available. We don't know when those MCAS exams are going to be administered. So right now the legislature is working with the administration and the federal government, because there is a federal component to this, to figure out what do we do? How does this, how do we get back to normal and make sure that students are graduating without being able to take the MCAS? So, these are the issues that are going on. These are the discussions that are happening. But I think our communities are really, they're really meeting these challenges head on. I'm just so proud to represent, our district and to have the people here in Foxborough that are doing incredible work.
Thanks, Paul. And so a couple of the things that you guys have both sort of danced around is like the relaxing of laws or the changing of guidance. And from where I'm sitting, it just seems like you make the laws, just wave the magic wand and cancel MCAS. What goes into these decisions? Where do you guys get your information about making these decisions?
Well, I think it comes from every community in Massachusetts. Some communities are affected more than others with this. Some communities aren't as well off as other communities, and so there's a spirit of equity, and how do you do it? And we also owe it to the students, and there's different interests, right? So it truly, it's a lot of work to come up with what is the right solution, what is the right answer, and get it into a legislation, right, to get everybody on board. So it is a challenge, and it's ongoing discussions. Like right now, we're just ripping another Band-Aid out of the first aid kit, right? And look at what we were having discussions last Friday with our local YMCA. Foxborough is blessed to have a Y that's running a program there. They're running food. They're taking care of the families of the emergency responders.
Yeah, they have emergency childcare there as well.
Yeah,
Right.
and you know, and they're trying to, they're relying on their reserves. People might think that the childcare costs are covered. They're getting maybe half of what it costs.
Really?
So that's a community investment that they're making to make sure that these kids are safe, that their parents can go to work and, you know, face those risks that they have. All of them, police, fire, frontline medical personnel, but they don't have to worry about their kids, right?
Yeah.
So that's some relief. But in terms of the education piece, you know, I've got friends that are on the education committee, you know, and they're pawing through things, and the chairwoman is, in the House anyway, is trying to come up with some solutions. But you're dealing with superintendents, you deal with teachers, you're dealing with parents.
Yeah.
You know, what do you want? What's your local school committee want? So it's not easy. We've got, what, 300 school districts. I mean, yikes. So this is another Band-Aid. Let's see if we can stop the bleeding for another week and, you know, keep working our way down the list, because it literally is a list. And it's just, you know, when you get through one, you cross it off, go to the next, and whatever that list is. When we what day it was, Monday, we got the essential business list. And that thing came out, and my phone started blowing up with people saying, well, I'm essential, I've got to work, you know, they got to feed my family.
I got to pay my mortgage, I got to pay my rent.
Yeah, so what, you know, how did you guys decide? So it's Thursday, and I'm still waiting on some answers that we put in right away on Monday. So those are the challenges that we're faced with on all aspects of this, right? So the Band-Aid, okay, on the unemployment, we waived the 7-day wait. The Band-Aid on schools, we closed them in the first couple weeks. Again, as Paul said, we had a meeting that Monday, school was closed Friday, nobody saw it coming.
But all these decisions that you're describing, they require a vote, right? Are you?
Well, the governor does it under the emergency declaration, I guess. Is that how you define it, Paul?
Yeah, and Jared, I think you make a perfect point. The legislature is not immune to this issue either. I mean, we've taken to Zoom calls like I'm on right now, video calls and conference calls, in trying to legislate, which is difficult for, you know, a body of 200 people, 160 reps, 40 senators that are used to, you know, quite frankly, working out deals in elevators and hallways, right?
Right. Sure.
So, you know, now we're all trying to have multiple conversations and try and figure out what goes into legislation, not only just on schools, but really about everything. I mean, you know, we've had the opportunity over the last couple of weeks to really dig into a lot of these issues, because it is a house of cards. You move one and the entire house could crumble. So we're trying to figure out, you know, how do we triage these situations? How do we take care of the most important and the priority pieces? And then what happens? What are the domino effects that happen after that? I'll give you a perfect example, right? And this is something that, you know, a lot of people don't think about. And quite frankly, most legislators wouldn't think about until we have to deal with it. You know, we are essentially, I don't want to say shut down, but you know, many businesses are shut down. Many departments in state government are working on a skeleton crew. Well, what do you do if you're an electrician and your license expires? You're not able to get your license renewed. So how do you work? What do you do if you are a plumber and your license expires? You're not able to get it done. Myself, my driver's license expired last week. I couldn't go to an RMV and get a new driver's license. So the RMV had to issue, you know, an extension order on everybody's driver's licenses and credentials. We had to do the same thing for the trades. If you have a professional license that expires, it is now extended, right? So it's a lot of these kind of nuanced issues that you would never even think about, that we have to come together as a legislature, and one of two things could happen. If the governor has the authority to make changes by executive order, that's great. It's usually a lot more expeditious if he does it that way, and he can, you know, issue an order and it gets done quickly. If it has to be done by legislation, like things that we're talking about now through unemployment insurance, and as Gia mentioned earlier about, I think we talked about the municipal bill and town elections. If that has to be done by statute, then we have to figure out a way to do this and to vote. Up till now, we've made sure that each of these pieces that we've been passing have unanimous support, so that we can do it in what they call an informal session, so that we don't have to be in the same chamber with each other taking a vote. But, you know, this is going to be a challenge going forward over the next couple of weeks. Right now, to give a perfect example of some legislation that we're working on that you think would be easy, but it becomes a little bit of a challenge in these times, is alcohol service. So the restaurants are closed down. You can't go and sit at Union Straw or at Conrad's and have a meal, have a plate of steak tips and a cold beer with your dinner. So they're relying on takeout service, they're relying on delivery service, but the restaurants are getting crushed. The workers are losing wages. The restaurant owners are, they're getting hit in the pocketbook. So how do you fix that? How do you offer some relief? So one of the ideas was to allow alcohol service for takeout and delivery. They certainly have inventory. They have closed containers of beer and wine. Should they be able to sell that? So they're talking now in the last couple of days amongst the legislatures, well, how do we do that? Governor Baker put it in his municipal relief bill the other day. The legislature is trying to figure out what the legislation is going to look like, because now when you talk about delivery of alcohol or curbside takeout of alcohol, which I support and I think it's important, well, what do you do for age verification? What do you do for enforcement to make sure that IDs are being checked, right? So there's all these issues that need to be figured out with every single item that comes up, and I think that's probably one of the reasons why Jay and I have been working 18 or 20-hour days with our colleagues trying to figure it out. But it's a process. It is a process, and I think we're getting through it one step at a time. But there's
under
a lot
the
of
current
challenges.
Circumstances, if someone disagrees with that, if somebody says, well, gee, if you can sell beer, why can't you open my pot shop?
Yeah.
Right? So all you need is one legislator to run down to the State House, bust through the security and through the Perel line, and hold it up.
Of course.
And then it doesn't get done.
Right.
And so then, as he says, my good friend, we negotiate in elevators and hallways. There's none of that going on. So it's really, so you're a little bit like walking on eggshells to get something like that done. It sounds, as Paul said, it sounds like pretty simple, right?
Wave your magic wand.
Wave the wand. But when you think about, and what I've learned in this job is how big government is. It's absolutely amazing to me. And it goes from one thing to the next thing to the next thing. It's everywhere. So a simple move, and sometimes I go in thinking like as a layperson going, business guy, okay, this ought to be easy, right? And then you run into the wall, right? The bureaucratic wall that says, oh no, with the license stuff, you got to be able to deliver those. With the registry of motor vehicles, that's almost as busy as any entity. I think it's the busiest in any entity in state government. Wow. People are now trying to get their license to comply with the federal rules. We delayed that, because we couldn't get it negotiated in the legislature. We finally got a bill passed. But we ate up, 12 months, Paul, messing around with that, just to get the license stuff done. We lost 12 months, and now the registry's closed. So when things open back up again, what's that going to look like?
Right.
Our office goes back and forth to the registry every couple of days, and we've got stuff down there 2 weeks ago that they shut it down, and we don't have the person's plates. Inspection stickers have been waived for a number of days. So there's a lot of things going on, and again, when we try to think of something to help the businesses, now we're on week 2 for the restaurants, coming in on 2, right?
Right.
Like, to do this alcohol thing if it can help them. Well, you get into all these other minds.
Yeah, but I'm hearing 2 things from you, which is that things are going to return to normal. It's just a matter of when, and you're looking forward to when that's going to happen. And B, there seems to be this huge amount of bipartisanship right now. I'm sitting in the room with a Republican. I've got a Democrat on the phone. Every time I've met with both of you guys together, you always seem to get along so well. And the Senate last night, the U.S. Senate just passed that bill. I think I read it was 96-0 unanimously. Yep. Everyone that could be there voted for it. Is this, the country was so divided 2 months ago. Is this bringing people together? Are you seeing it?
I hope so.
Yeah?
Paul and I get along great. And I think, and I don't know why, I love the guy, but we have mutual respect for what we each think. And I am a Republican. I'm conservative guy, business owner. He's on his side. But I'll tell you, when it comes to this stuff, and I think finally the federal folks have figured it out, that the only way to get any action is to come together and figure it out. And they were, Paul, you probably agree, they were miles apart a few days ago. It was wider than the Grand Canyon, what, both sides wanted.
Yeah.
So I'll let you talk.
Yeah, no, you said it right. And Jared, my God, I mean, Jay and I probably couldn't be more opposite politically on some of the global issues. And, when it comes to fighting those larger policy issues, we give it to each other pretty good sometimes. And, of course, I'm always right, but I'm respectful of his wrong opinion. But that's something that happens, right? That's politics. It's government. That's why we're in this game, is to advocate for our own positions. But when it comes to a crisis, when it comes to a public health emergency, when it comes to what is amounting to a battle here across the Commonwealth and across the country, man, there is no time for that stuff. There's no time for partisan bickering. There's no time for politics. That is not what we are elected to do. And I know it sounds cliche, and I apologize for that, because it sounds like it's pandering. I believe in the bottom of my heart, I know Jay does too, this is one of those times where all of that has to be put aside. When people call us, I can't tell you the amount of pain that I hear in people's voices when they call my cell phone and tell me, Paul, my business that I've spent the last 10, 15, 20 years of building literally is going to be crushed in a week. Or, Paul, I am scared to death because my daughter is on a ventilator in a hospital and I can't go visit her. Or, Paul, I'm worried that, I'm not going to be able to come through this okay, that I can't afford to pay my rent or my mortgage this month. They don't care if I'm a Democrat, if I'm a Republican, if I'm a Libertarian, or what I am. They just want some help. And whether they reach out to me, or they reach out to Jay, or they reach out to any of the other legislators in the Commonwealth, they're looking for leadership. They're looking for help. They're looking for assistance. Jay and I are blessed to have a great staff. And they are struggling right now trying to answer everybody's phone calls and emails. But we're trying to lift them up too and say, look, this is what this job is. It's what it's about. And, this is how it's supposed to work. It is not easy times. It is painful for a lot of people. But we will get through it. We will get through it if everybody comes together and does a little bit to slow the spread of the virus, to lift each other up, to shop locally, go to takeout at our local restaurants, throw them a little bit of extra money. If you have it, take care of the tipped workers, to thank a nurse and to make sure that they're getting the correct, proper equipment, the firefighters and the police officers, to make sure that they know how much we appreciate them in this situation. We'll get through it. I mean, we're going to see some challenging and difficult times, but this is also when a community like ours rises up. It's when a Commonwealth like ours rises up, and it's who we are as a people, and our country could and should be coming together right now. It just takes leadership, and it takes people coming together and putting aside their differences. And we're seeing that here locally, and I'm just, it's challenging, but I'm just so proud of our own community here.
Me too. Thank you so much for that, Paul. And I'm going to take that message of hope and inspiration, and I know I'm going to bring it back to my house. Hopefully people watching at home can take it into their house. But I just want to say on a personal note, I'm so proud to have both of you represent me at the state. I appreciate all you're doing. I can't imagine the difficult time that you're in. I know it's hard for everyone, but it feels like a lot of weight is falling on your shoulders. And personally, I've been looking to my local leaders more so lately, because this feels like a very local issue, even though it's happening everywhere. Thank you both so much for all that you've done. I want to thank Representative Jay Barrows for being here, and State Senator Paul Feeney for joining us via Zoom. My name is Jared Craig. This has been Around Foxborough. Thank you so much for tuning in. Have a good one.